Hi, so today is Sunday the 4th of June, day 5 post-operation, and I thought I'd do a bit of a longer update today, covering firstly just how I'm feeling in general, talking a little bit about vices, drugs, and also diet and supplements that I'm taking so far. So starting with how I'm feeling, I've been feeling pretty good today. As you can see, sitting is relatively comfortable. Of course, I had to sit with a very straight back, so I think it would start getting tiring after a while, but I was able to have a 2-course sit-down lunch this afternoon with the family, which was nice. Also getting more comfortable walking, and especially considering that yesterday I walked more than 5,000 steps, went for a bit of a longer walk today, and pace was a fair bit quicker than yesterday. I think yesterday I was only managing 24 minutes per kilometer. Today it was something like 19 minutes per kilometer. So still slow, but definitely steady progress. Pain more manageable, I would say, as well. So I've kind of managed to only take drugs once so far today in the morning, and I'll do my other kind of set of drugs just now because it's almost 8 o'clock and heading towards bedtime. What I have noticed is that there's definitely weakness on the left-hand side of my body from the kind of compression on the sciatic nerve that I had as a result of the herniated disc. But it's already getting better, so I can feel it getting stronger. I can feel less and less pain. And as I mentioned, one of the first things I noticed after the surgery was that the nerve pain that was there previously was kind of entirely gone. So in other words, I could feel there was no longer pressure on the sciatic nerve. All right, so moving on to vices. I stopped smoking about 2 years ago, but I then took up vaping with a fairly heavy nicotine content within there, and that kind of carried on for a while. But as soon as I learned that I was more than likely going to need surgery, I decided to stop that as well, because firstly, I read that nicotine is a big no-no when it comes to bone healing. And also, funnily enough, when I was in high care in hospital after my surgery, I was next to a gentleman. He was a little bit older than me, mind you, but he was in for a second surgery because the first surgery failed as a result of him smoking heavily after his first surgery. So definitely, my tip for the day is stay away from nicotine as far as you can, quit as long as possible before your surgery, and obviously then stay off it once you've had your surgery. Alcohol, I used to drink, I would say mostly over the weekends, but I've decided to also put that on ice for a while, for at least 8 weeks, and I might even push that to 12. The reason being is that I've been told that it's going to take somewhere between 6 to 12 weeks for the screws that have been put into my back to grow into the bone. Obviously, anything like alcohol that's effectively poison to the body is not a good idea. But secondly, I also wouldn't want a kind of careless moment after a couple of drinks to kind of set me back on that journey. So that's as far as it goes in terms of vices. Then moving on to drugs. So I've got 4 here that I've been prescribed. So the first is Targanact, which effectively is oxycodone, which is an opioid-based painkiller for moderate to severe pain. So I'm taking that once a day in the morning, and it's only been prescribed for 10 days. I then have Neurica, which is pregabalin, which effectively is meant to block pain from damaged nerves. And I'm taking that once a day in the evenings. So as I mentioned, in my case, there definitely was some nerve damage that was done for that month whilst the nerve was compressed, and hence why they would have prescribed that. And it's been prescribed for 30 days. So what I've been told is, you need as much time post the nerve compression as the nerve was compressed for it to heal. So 30 days feels about right. Then there's Vimovo, which is naproxen, which is an anti-inflammatory. So I've been prescribed that twice a day for 20 days. And then the last one is Synaleve, which is basically paracetamol, codeine, and meprobamate. So meprobamate is interesting as it's typically used to treat anxiety actually. So I guess the objective here is to try and keep you as calm and relaxed as possible in order to heal the healing process, whilst the paracetamol and codeine kind of numbs the pain out as well. But that's being prescribed up to 3 times a day, also for about 10 days. So those are the drugs I've been prescribed. If you want to compare that to maybe what your doctor prescribes to you post your surgery, hopefully that's helpful. Moving on to diet and supplements, trying to get the diet to be back to normal as quickly as possible. But I must say I don't really have the desire for anything that's hard to digest at the moment, like cured meats, etc. What I did read was that spinal surgery does cause a bit of a disruption to digestion for the first 2 or 3 days after surgery, and of course that will take some time to get back to normal, and hence I'm not that concerned about it at the moment. But as I say, trying to keep the diet as normal as possible, eating 3 meals a day with a little bit of snacking in between. So in terms of snacking, what I'm typically doing is taking protein shakes, because I did read that the body does require a bit more protein as part of the healing process post-surgery. Also calcium is critical, given that you're talking about bone healing, and hence why going quite high on the calcium supplements, as well as the omega-3 oils for vitamin D and vitamin A. Also just taking a general immune booster supplement, just given that there is a fairly large cut in my back, which is in the process of healing, and anything that one can do to avoid any infection, I think, can only be a good thing. And then finally, just a kind of general multivitamin, just to make sure that anything I might be missing in my diet is caught by the multivitamin. But yes, as I said, after 5 days, feeling pretty good. Very pleased with the kind of progress I'm making, looking forward to sharing a bit more maybe around day 7, kind of a week post-op. Chat later.